If your feet ever feel numb, tingly, or like you're walking on a thin layer of cotton wool, you're far from alone. It's one of the most common complaints people bring up as they get into their 60s, 70s, and beyond. Maybe it's worse in the morning. Maybe it creeps up your shins by evening. Maybe your feet just never seem to feel properly warm anymore, no matter how many socks you put on. Whatever the pattern looks like for you, it's worth taking seriously. And it's also worth knowing that there's a lot you can do about it with nothing more than a chair and 10 quiet minutes a day. Today, I want to walk you through 4 simple seated exercises. No equipment beyond a rolled-up towel. No standing, no balancing, no risk of falling. Every single move is done sitting down, and you can start the first one within a minute of reading this. An honest word before we start, I want to be upfront with you, because too much of what's out there on this topic overpromises. These exercises can genuinely help with circulation, joint mobility, muscle strength in the lower leg, and balance. Consistent movement is one of the best tools we have for keeping blood flowing well to the feet and keeping the muscles that support your gait from weakening. What these exercises will not do is reverse nerve damage on their own, replace medical care, or diagnose what's causing your symptoms. Numbness and tingling in the feet, in medical terms often grouped under peripheral neuropathy symptoms, can come from a wide range of causes. Diabetes, vitamin B12 deficiency, thyroid problems, poor circulation from vascular disease, prolonged pressure on nerves, certain medications, alcohol use, or nerve compression in the lower back. Some of these are very manageable once identified. Some need medical treatment that no amount of chair exercise can substitute for. So think of this routine as a genuinely helpful daily habit that supports whatever else you and your doctor are doing, not a standalone fix. If your numbness is new, sudden, spreading quickly, affecting only one foot, or if you notice a wound, sore, or discoloration on your foot that isn't healing, please get that checked by a doctor promptly. Foot wounds in particular can turn serious fast when sensation is reduced, because you may not feel pain from something that's actually getting worse. With that said, let's get into the actual movement, because there is real, meaningful benefit here for a lot of people. Why the feet lose feeling in the first place? It helps to understand, in plain terms, why feet are often the first place people notice these changes. The feet are about as far as blood and nerve signals have to travel from the heart and spine. Long nerve fibers and small blood vessels running down to the toes are more vulnerable to problems along the way than, say, the nerves serving your hand. Add in hours of sitting, tight, or stiff shoes, and muscles in the lower leg that don't get much work in a typical day, and it's easy to see why circulation slows and nerve signals can feel muted or delayed. Movement helps on 2 fronts. First, it mechanically pumps blood back up out of the lower leg. Your calf muscles in particular act almost like a second heart for this job, squeezing blood upward through the veins every time they contract. Second, movement and light sensory input, like rolling your foot over a towel or lifting and spreading your toes, give your nervous system practice signals. Nerves, like most tissue, tend to respond better to regular, moderate use than to being left completely still. None of that is a guarantee for every case, since the underlying cause varies person to person. But for a lot of people whose symptoms are related to circulation, prolonged sitting, or general age-related deconditioning, a short daily routine like this one can make a real, noticeable difference within a few weeks. Warming up before you begin. Don't skip the warm-up. It takes less than a minute and it prepares the feet for the real work ahead. Sit tall in a sturdy chair with both feet flat on the floor, hip-width apart. Take a breath, relax your shoulders, and let your hands rest in your lap. Roll your right ankle in slow circles, 10 times in one direction, then 10 times in the other. Repeat with your left ankle. Keep the circles as wide and controlled as you comfortably can. This loosens the ankle joint and gets a little blood moving right away. Next, gently tap both feet against the floor, alternating left and right, 20 times total, like a soft, steady drum beat. Nothing forceful, This is about waking up the muscles and nerves in the sole of the foot, not stomping. That's your warm-up. Simple, quick, and it sets the stage for everything that follows. Exercise 1. Seated toe, raise and spread. This first move targets the small muscles and nerve pathways running through your toes and the top of your foot, areas that tend to go quiet first when circulation slows or when shoes have kept them compressed for years. If you're able to, take your shoes and socks off for this one. Bare skin against the floor gives your feet more direct sensory feedback, which can be a genuinely useful, gentle stimulus for feet that have gone a bit numb. Sit tall with both feet flat on the floor. Lift all 10 toes as high as you comfortably can, keeping your heels planted. Hold that lift for 3 seconds. You should feel a pull along the top of your foot and shin. Now, while your toes are still raised, spread them as wide apart from each other as you can. Hold the spread for 2 more seconds. Then lower everything back down slowly and with control. That's 1 repetition. Aim for 12. As you go, pay attention to which toes respond easily and which ones feel stiff or slow to move. For most people, the smaller toes, especially the pinky toe, are the hardest to control and the slowest to wake up. That's completely normal. Give those toes a little extra focus on each spread rather than rushing through. If your toes cramp partway through, that's a sign to ease off the intensity slightly rather than pushing through pain. A mild pulling sensation is expected. Sharp cramping is a signal to back off. Exercise 2. Seated calf pump with foot press. If your feet tend to stay cold even when the rest of you feels warm, this exercise speaks directly to that. Your calf muscles are the strongest circulation pump in your entire lower leg. When you sit for long stretches, that pump barely gets used, blood pools lower down, and your feet end up a little starved of the fresh, oxygen-rich blood that keeps tissue, including nerve tissue, functioning well. Sitting tall, raise both heels off the floor, rising up onto the balls of your feet. At the very top of that lift, press the balls of your feet firmly into the floor and hold for 2 seconds. You should feel the squeeze travel through your calf muscles and a spread of pressure across your arches. Lower back down slowly. Really slow this part down, taking a full couple of seconds to control the descent rather than just dropping your heels. That's 1 repetition. Do 20 of them, aiming for a calm, even pace. Roughly 1 full raise and lower cycle every 4 seconds. There's no need to rush. In fact, the slow pace matters here. If you move too quickly, you end up bouncing rather than fully squeezing the calf muscle, and you lose most of the circulation benefit. A lot of people notice actual warmth spreading into the feet by the later reps of this exercise, especially if their feet started out cold. That warmth is simply blood arriving in tissue that's been sitting cool and still. It's a nice, tangible sign that the exercise is doing what it's meant to do. Exercise 3. Seated foot, rolling with a towel. This one reaches an area that a lot of standard foot exercises miss. The arch of the foot and the band of tissue running along the sole, called the plantar fascia. This part of the foot is packed with nerve endings, but between thick-soled shoes and flat, unchanging floor surfaces, it often gets very little varied stimulation over the years. You don't need anything special. A rolled-up hand towel works perfectly well. Place the rolled towel under the arch of your right foot. Slowly roll your foot forward and back over it, moving from the ball of your foot down to your heel, pressing gently into the towel as you go. This isn't a stretch. You're not trying to lengthen anything. You're giving the sole of your foot varied pressure and sensory input. As you roll, notice where you find spots that feel tight, tender, or oddly numb compared to the rest of your foot. When you find one of those spots, pause and hold steady, gentle pressure there for a full 10 seconds before continuing to roll. That sustained pressure gives that specific area a stronger signal than a quick passover would. Roll your right foot for about 60 seconds total, then switch to your left foot and repeat. Beyond circulation and sensory stimulation, this exercise also has a genuine connection to balance. The nerve endings in the sole of your foot feed into your sense of proprioception, your body's internal sense of where it is in space. Keeping that pathway active through regular stimulation is one of the small, cumulative things that can support better balance and a lower risk of stumbling, especially as we get older. If your towel feels too firm, roll it more loosely for a gentler press. If you want a bit more pressure, roll it tighter. The goal throughout is steady, comfortable stimulation, never anything that produces a sharp, wincing pain. Exercise 4. Seated shin taps and ankle circles. This last exercise ties the whole routine together, and it targets something with real everyday relevance. The muscle running down the front of your shin, called the tibialis anterior. This muscle is what lifts the front of your foot as you walk. When it weakens, which can happen from age, inactivity, or nerve changes, the front of the foot doesn't lift quite as high with each step. That small deficit is often exactly what causes a toe to catch on a raised edge, a rug corner, or an uneven bit of pavement, turning an ordinary step into a stumble or a fall. Keeping this muscle active is one of the more practical fall prevention relevant things you can do in a seated routine. Sit tall with both feet flat on the floor, keeping your heels planted throughout. Lift the front of both feet, toes and the balls of your feet, as high as you can while your heels stay grounded. Hold for 2 seconds, feeling the muscle along the front of your shin working. Lower slowly. That's 1 shin tap. Do 15. Next, lift your right foot a couple of inches off the floor and draw 10 slow, wide circles with your ankle. 5 circles in one direction, 5 in the other, making each circle as large and controlled as you comfortably can. Set your foot down, then repeat with your left foot. Some people notice a tingling sensation spreading through the foot during this exercise, particularly the first few times they do it. That's generally just nerve tissue and muscle responding to activity they haven't had in a while. But if you ever feel sharp pain, numbness that worsens, or anything that feels distinctly different from normal muscle fatigue, stop and check in with a doctor rather than pushing through it. The ankle circles at the end connect the whole chain, shin, ankle, and foot, into one continuous movement, which is why this exercise is placed last. By the time you finish it, everything you activated in the earlier exercises has had a chance to work together rather than in isolation.